glaucoma. We know the pathophysiology, we know how it comes about. But as to what makes one person get glaucoma and the other not get glaucoma, we cannot tell. So we don't have a cure for glaucoma. But what we do initially, and I must say, glaucoma is a disease that's managed by surgery. It's a surgical problem, meaning your eye must be operated on to create a channel for this water or this aqueous humor produced in the eye to leave the eye. And the only way of doing that is by creating a channel for the aqueous humor to drain out. But whilst we are waiting for that, to do that surgery for you, we will put you on topical medications which help in the drainage of the aqueous humor. Where the topical medications are not really helping much, we can move a step higher by using laser to create channels in this structure that allows the aqueous humor to drain out of the eye into your circulatory system. And where the laser also fails us, or depending on the stage of your disease or your condition, then we'll do surgery for you. We'll go a bit more into these things during the panel discussion. So, because glaucoma doesn't give you any form of symptom of anything, we advocate that if you are 20 years or below, at least every 2 years, go to the eye clinic, get your eye comprehensively or extensively examined. And for those between 20 to 30, at least also every 2 years, get your eye examined by an ophthalmologist. After 30 years, we are preaching that you do this screening at least every year. Same for those who are above 40. But if you have a positive family history, if there's anybody in your family who has glaucoma, then our advice is that don't do it 2 years. Get your eye screened every year. And when you are going, please carry your family along. Your family includes your father, your mother, your sister, your brother, your wife, your children, and even sometimes your friends, because some friends stick better than brothers. And there are some things that we can also do to guard against some of the secondary glaucomas that we mentioned. Today we are preaching and advocating that if you are taking any steroid that was not prescribed by any physician, please stop or desist. Don't just go to the pharmacy shop or the chemical shop and procure steroids because you think they are helpful to you, or somebody said they took them and their condition resolved. And let's avoid bleaching creams. Let's avoid bleaching creams because you can become fair. You can turn a white person, but you'll be blind because of the side effects of the drug on your eye. Our skin is very beautiful. God created it specially for us. We are the original race, so let's maintain our skin color. For black is beauty. And if you have diabetes and hypertension, please don't listen to anybody. Don't listen to anybody who sits on radio or TV and says that they have this medication now if you take one time, it will take away this diabetes and hypertension. Please control your sugars and your pressures with the medication prescribed by your family physician or your physician specialist. It is important because when all these things get out of way, you might be fearing a stroke, but you might not have stroke. You can develop glaucoma and you may lose your sight if you don't listen to your physician. And please, as parents at home, let's try and educate our children about protecting themselves, doing things that can harm their eyes. Because when we were younger, I remember we used to use a rubber band, we fold a paper, then you pull like a catapult or a sling, then you throw it at a colleague, and it will hit their eye, then we'll laugh about it. But most of these injuries tend to cause some form of secondary glaucoma in these children when they are older. And as I said, it doesn't give you see. Once you have perfect vision, your central vision, you think you are seeing. By the time they report to us, the disease is always advanced. So let's educate our children about these kinds of activities that they do that tend to cause ocular injury. And if you are somebody who is involved in manual work, any form of manual work, we will advise that you use goggles. Try and use goggles, protective goggles, so that anything that might harm your eye or injure your eye will be shielded by these goggles. And if you have any eye problem, please don't go to the pharmacy shop. I know our chemical shops and pharmacy shops are very, very welcoming. That if anything happens to your eye, if you feel some dryness or this thing, you go and they are giving you some topical eye medication that you don't even know what it contains. Most of the time, what they will give you contains some form of steroid. And this steroid will just solve your problem, your immediate problem for you, might solve your immediate problem for you, but in the long run, will give you glaucoma. So, one, we are leaving with this message. One, talk to your family about glaucoma. When you hear this, talk to your colleagues, your family about glaucoma. You yourself, get screened. Stop self-medicating, and when you hear that we are doing screening or you see posters or you see anything about glaucoma, screen anything, please share them. Tell others about it. Let them get screened so that together we may fight this thief that has been stealing our sight. So I'll leave you with this message. Protect your sight. Schedule an eye exams today. For glaucoma, it's permanent. And it's silent. A silent threat to your sight. Thank you, and I'll hand over to our moderator for the discussions.
Thank you very much, Dr. Anko. Thank you very much. Very, very wonderful presentation, very excellently delivered. If you are now joining us, this is the Korle webinar series, the June edition. We are being joined by a wonderful panel from the Lions International Eye Center here in Korle, with a lot of knowledge on glaucoma. We just completed the first part of our presentation where we have been given in-depth insights into glaucoma. While that was going on, we had some interactive questions coming in. This question, I would read it out to my panel and let's see how we can deal with it. So the question is, what is the difference between someone who has glaucoma and another person with a dislocated disc? What is the difference between someone who has glaucoma and other person with a dislocated disc? Like I said earlier, this is the Korle webinar series, the June edition, and we are discussing glaucoma. If any member of my panel will be kind enough to address this question. Let me take the question once again. What is the difference between someone who has glaucoma and another person with a dislocated disc? Thank you very much.
Hello, everyone. So hello, everyone. Yes, I'm Dr. Patieboa. I must say there's nothing like a dislocated disc. Okay. Hello, everyone, once again. So I'm Dr. Patieboa. So I must say that there's nothing like a dislocated disc. What we know, we have other forms of disc problems that can happen. So we can have Okay, so we can have other problems affecting the disc. Some people are born with anomalies of the disc. Some people have swollen disc, but there's nothing like a dislocated disc. So the person has to come again, yes, so that we can address exactly what he or she meant by dislocated disc. Thank you. Or
Ok-
lens. The person meant lens.
Okay, so riding on the back of that, I would appreciate it if you could tell us the difference between glaucoma and a cataract.
Okay, all right. So cataract and glaucoma are two entirely different things. So when we talk about cataract is basically the lens inside the eye. The same way we have lenses in our cameras, in our phones. Basically, I can say that the lenses in our cameras, in our phones were designed based on how the eye is. So the eye too has a lens inside, and that's what transmits what we see to the nerve that was mentioned earlier, to the brain, for the brain to interpret that what you are seeing is an animal, is whatever it is. So cataract is basically when the lens inside the eye becomes cloudy. It loses its transparency. It's supposed to be crystal clear like water. But glaucoma is totally different. For most people, the pressure is high and it affects the nerve of the eye. So there are two different things. But having said that, some types of cataracts can actually predispose you to getting the acquired or the secondary forms of glaucoma. So they can be related, but they are totally two different things.
Very well said, very well said. But this disease, glaucoma, does it have a local name? This disease, glaucoma, does it have a local name?
So in our local parlance, it's known as hinta nifrae. Hinta nifrae. That means that or hinta. So basically you can't see it coming, it just creeps on you. So that's the local name for glaucoma.
Okay. And what is cataract?
Ete.
Okay. All right. Cataract is ete. Thank you very much. Thank you very much. They are giving us a lot of very good insights into glaucoma. Recently I was having an interaction with someone and the person said glaucoma. Is the word glaucoma or the word is glaucoma? If our doctors can let us know so that the general public also knows whether it is a gly or it's a glow. What is the word?
Well, the term is glaucoma, not glaucoma. So far, we've not had any condition called glaucoma. So let's take note of that. It's glaucoma.
Okay. Thank you so much. We are live on Facebook and YouTube. You can bring your questions in. We have very wonderful experts to give us all the information available on the disease process, glaucoma. There's another question that has come in here for Dr. Anko that says that, does buying these roadside medicated glasses trigger glaucoma? And the second one is treatment of glaucoma covered under the health insurance scheme? And by that, I'm assuming the person means maybe either the National Health Insurance Scheme or private insurance. So if you could address both, would be grateful.
Okay, thank you. So, so far we've not established any causal effect between roadside or any form of glasses with glaucoma. There's no causal effect. As I said earlier on, if you have a refractive error, you are predisposed to it. You are predisposed to getting glaucoma. Whether you have short-sighted, if you are short-sighted, that's you can only see things that are close to you. Usually, these people tend to have very long eyeballs, okay, and it stretches the nerve, the optic nerve. That's one thing, and they tend to also have the typical, the most common type of glaucoma that I spoke about. That is open angle glaucoma. And for those who are long-sighted, they only see things that are very far away from them, but do not appreciate things that are close to them. They tend to have very small eyeballs, and these tend to occlude the opening in front of the eye that drains the aqueous humor. But for glasses, we've not established any relationship between a correlation between buying roadside glasses and glaucoma. And yes, depending on the facility you attend, you report to, glaucoma is covered under the National Health Insurance. Maybe not everything under it. Maybe you do some form of co-payment depending on where the treatment you are being given.
Okay, thank you very much. If you are joining us, this is the Korle webinar series, the June edition. You said something about if an individual walks into a facility, it may be covered by the health insurance. But in your presentation also, you talked about several other things that are done when it comes to the management of glaucoma. You talked about eye drops, you talked about surgery, laser. Are you saying that the health insurance will cover all that, please? Any of you, please?
Yeah. So some of the eye drops. So this is one of the points where we are trying to advocate. So unfortunately, most of our eye drops are not under the National Health Insurance scheme, except a few. I think 2 of them, and the tablets. Some of the medications can actually be given for you to swallow. So the one that you can swallow and 2 of the drops are the only ones that are under the National Health Insurance. But the good news is that most of the surgeries are subsidized by the National Health Insurance, except the lasers. So most of the surgeries are subsidized. So you may end up paying about 50% less than what you would have paid. Yes. So there's some benefits under the National Health Insurance, but the lasers are not covered.
And let me also add that, as Dr. Ebo rightly said, even though most of them are not covered under the National Health Insurance, some private health insurance schemes do cover them. In fact, some of the high brands and top brands are covered under some private health insurance. But we also, luckily for us, I think luckily for medicine in our parts of the world, we also have some of these medications. They may not have those high brand names, but they are also very affordable. They are really affordable that I think the ordinary Ghanaian can easily afford, can easily purchase.
Thank you very much.